listening to Don Carpenter on News Talk 1270 KIML. Call Don right now, 682-1270.
News Talk 1270 KIML, Don Carpenter Show. Thanks for joining us this morning. And in studio, if you're just joining us, we have Peter Edis and Mike Purcell from Campbell County Memorial Hospital. And we're here this morning. We're going to talk a little bit about kickoff of a new suicide prevention campaign. Thank you for joining us this morning, taking the time to talk to us, and I'm sure we'll learn quite a bit here. And actually, I want to start off. I mean, since I'm fairly new to the area, I've only been here a few months. One of the first things I heard when I came here is that Wyoming in general and Campbell County in particular, that suicide is a major problem around here. And I mean, can you tell us a little bit about that? Doesn't matter, whoever you think is, you can decide amongst yourselves who is more qualified to talk about it.
Sure, Don. I'll start out. Yeah. Unfortunately, Wyoming does lead the nation in per capita successful suicide completion. I think we've had 13 suicides already from the beginning of the year to present date in Campbell County. It's a significant problem that we need to do something about. It's particularly acute amongst the younger adults, and it's kind of pervasive, though, through all the various ages of people living here in Wyoming.
So it's not just a problem that and I think a lot of people might have the misconception that it's depression and suicide is something that's kind of disproportionately affects younger people. I mean, when you hear about suicides, a lot of the time it's younger people that you hear about. So this is something that is pretty much through all age ranges. Then. Good
point, Don. There's a tremendous correlation between depression and suicide. It was interesting that I was part of a research group back in the 1980s doing research on seasonal affective disorder. It qualifies as a type of a depression, but the people that would get seasonal affective disorder and subsequently that depression, they always knew that come spring they would get better. And for the people that purely had just that, there was a zero suicide correlation, whereas with depression that isn't of seasonal nature, it's pretty strong correlation between the two. So when you have people that are suffering clinical major depressive disorder, what we noticed was that they had this belief that they were not going to get better, and that increased their risk of being suicidal.
And so it's one of those things where I mean, I guess I mean I've never dealt with it personally, but I've known people that have dealt with clinical depression, and you kind of get this feeling like there's no escape and it's hopeless. And so this is something that doesn't affect seasonal depression. Then
we don't worry so much about suicidality amongst people with the winter blues, the blahs,
right. And I'm sure that's probably something that happens quite a bit around here in the wintertime.
Oh, sure. People stay indoors and
sure
and gain weight too.
Oh well, I think I gain weight all seasons of the year. So, but that's a topic for another day. Looks like we might have a call. I was actually going to open the phones up a little bit later, but we'll give it a shot. News Talk 1270 KIML, Don Carpenter Show. You're on the air. Okay, going. Okay, well, we'll actually open the phones up a little bit later on. I want to try to talk about a few other things before we get to the question and answer period. But we'll save some time for that if you do have any questions. Is there any theory about why this is a problem in Wyoming and Campbell County in particular?
It's interesting that you asked that question because people do want to know why. But what's most important is that the fact is we have a significant suicide problem in Campbell County, and we need to come together as a community and look at ways in addressing that, which is this campaign is part of that effort, is coming together as a community. Suicide's a community problem. It requires a community response. It's not going away. We know that. And we need to mobilize our community, get people that have a passion for this, and get the word out there that there is help available.
Yeah, right. So I guess the point is that whether we ever figure out why it's a problem or not, it's a problem and it does need to be addressed. And
certainly, I mean, there's lots of risk factors, and this area has several. One is we have a transient population. We have a relatively young population. We have with very few resources. A lot of our workers are transient. They don't have family in the area to support them. That certainly is a risk factor. Our weather, long, cold winters, is a risk factor for depression. Depression is a risk factor for suicide.
So, and I guess one of the other things, I mean, is this a problem that, it's a blue collar community and it's, really hardworking people. And it's very the Western mentality is very individualistic. I mean, is that something that people just maybe they're too proud to get help if they need it?
Certainly, we live in a culture that says pull up your bootstraps, move on, and deal with it. And with these types of issues, it's not always the best tactic to resolve it. As a culture as a whole, we don't encourage, or let's say we encourage it a lot less than we should, is for people to go out and get help. It's not socially acceptable to ask, and we need to change that norm. The other thing that really is a significant factor, I believe, is that people don't always take suicide threats seriously, and we need to take them 100% serious every time.
Oh, yeah, and then that's actually one of the things maybe we'll talk about on the other side of the break. We're up against our first break already. When we come back, maybe we'll talk a little bit about how this program got started and what the program involves. So stay tuned. News Talk 1270 KIML, Don Carpenter Show. We'll be right back.
For the latest on the show, follow Don on Facebook. Just search for Don Carpenter Radio. News Talk 1270 KIML. Call Don now, 682-1270. News Talk 1270 KIML.
News Talk 1270 KIML, Don Carpenter Show. And if you're just tuning in, we're talking with Peter Edis and Mike Purcell from Campbell County Memorial Hospital about the new suicide awareness and prevention campaign that's going to be kicking off. And actually, I want to mention the sponsors while we have a chance. Of course, it's Campbell County Memorial Hospital Behavioral Health Services. The Campbell County School District is going to be involved. The Suicide Prevention Coalition and the Maddie Project, as well as us here at Basin Radio. And we'll be playing spots, for the I think let's see. For the next, I think it's for the next few months at least, right?
Actually, it's a whole year.
Oh, it's a full year. Wow. Okay, that's good. That's good. So, so in the last break, we kind of talked about the problem that suicide is. I guess the next logical step would be to talk about how to spot maybe some of the signs and what to do if you do spot some of these signs. I think everybody has known somebody that, might have a little bit of a problem with depression, but we might not know the signs of, somebody that's actually contemplating harming themselves. So what should we be looking for?
Well, it's interesting that you ask because there is a false belief that once someone has made up their mind to commit suicide, that there's nothing you can do to change it. And that just is not true. Everyone shows signs and symptoms, and we need to become familiar with them. If you know somebody well, and they show a change of behavior, change in mood, change in patterns, certainly that is something to be aware of.
Sure. Peter mentioned earlier that the population out here in Campbell County is, due to the nature of our industries here, is very transient. Unfortunately, one of the direct results of that is that people don't have quite the social connectedness, and one of the symptoms that is very, very common in suicidal behavior is social withdrawal. So if we already start with a lack of a significant group to socially connect, that can help people be more aware that, hey, this is somebody that's basically starting to decline. They don't seem as bubbly, as perky, as talkative, as socially engaging as they used to be. They're forfeiting a major checks and balances to help get them some help. Again, in the West, and it's interesting that the Western United States, with the exception of California and Washington State, all has the highest rate of suicide in the nation. Wyoming just happens to be the king at this moment in time. So we're looking, unfortunately, with some of these rural areas too, particularly Wyoming. There's this, I think the saying is cowboy up. You just basically pull yourself out of it, which unfortunately is one of the worst tools that someone should use to help remedy depression or suicidal contemplation. So
it's one of those situations where somebody needs professional help. I mean, it's not something when you're talking about a major depression, it's not something you can just dig yourself out of. I mean, you really do need professional help.
And let me jump in here as well. It's not just major depression that causes suicide. Major depression is easier to spot. It's the impulsive suicides that are more difficult to spot.
Mm-hmm. Correct.
Oh, okay. And what would be some of the? I mean, I guess social withdrawal is one of the signs. But what other signs could you be looking for somebody that might be at risk for an impulsive suicide?
Lost job, failed relationship, financial strain,
increased
illness,
increased substance
abuse,
yeah.
substance use.
So I mean, somebody that might be kind of getting in kind of a self-destructive spiral because of an event that took place. Like you said, losing a job or a
breakup of a relationship.
A breakup of a relationship. I mean, is that one of the? I'd imagine that's probably one of the big ones.
I can't answer that question.
Yeah,
I'm not sure.
Yeah, I mean,
it's probable.
It's probable. I mean, again, from my limited experience, and obviously it's a small sample size. I've only known a few people that have been involved with something like this. That it seems like. I mean, it's and I'd imagine that younger people are probably at more risk for something like that as well.
There's also another factor too, because 1 out of every 11 people that make a suicide attempt are actually successful with suicide. That is often misconstrued by a large number of people as it's just attention-seeking behavior, which is a terrible misconception. It really is a suicide attempt, and it needs to be addressed. Unfortunately, for the person that makes a suicide attempt, one of the factors that is very strongly correlating to another suicide attempt is having a previous suicide attempt.
Right.
It also runs in families.
Yes.
Oh, yeah. Now, I find it interesting that you mentioned the. I mean, is it a fallacy? I mean, is there such thing as a suicide attempt that's that is a cry for help or attention seeking? Or I mean, would you even consider that a suicide attempt? I mean, would that just be something, maybe somebody that self harms in a way that's not fatal?
I think there's a vast array of aberrant behaviors that people can do to get a lot of attention for themselves. I think suicide gesturing, suicide ideation, suicide attempts, that's its own subcategory. I think we need to address that one very, very seriously and not just look at it as any type of, I'm just going to do this to get some attention or get some help.
Even people who attempt suicide for attention-seeking reasons often or occasionally actually commit suicide, without meaning to. So they may have made the attempt to seek attention, but then end up taking their own life because by mistake.
So, and that goes back to the idea that it doesn't matter why it's going on. I mean, it's going on, and the result's the same.
Correct. The other thing too, we should point out and actually make a point of talking about is the fact that we know of 13 suicides in Campbell County. There are other deaths that may have been suicide related that we don't account for. There are over 200 attempts that were admitted to the hospital last year, according to the statistics I saw. So we're dealing with a very large number in a very small community.
Yeah, now, I mean, how does that compare to a city of 30,000 or a county of 40,000? I mean, how does that compare?
I think we're very high. The statistics I've seen, there's about 100 or so suicides a year nationally. So you can do the math. Mike has done the math.
Yes, I have the successful suicide completion rate from 2007 forward.
Okay.
Yeah.
So, I mean,
and it's a clear trend. The rate is going up, and in 2012 was a particularly bad year for Wyoming. We had 165 documented cases of confirmed suicide in Wyoming.
And 12 of those were Campbell County, and we're
13 so far this year. We're into
12 last year.
12 last year.
Oh.
Yeah. So we've already. We're barely halfway through the year, and we've already eclipsed last year's number. I mean, that's just insane.
We talk about being number one. This isn't something we want to be number one in.
Oh,
but unfortunately, we are.
Yeah. I mean, it really is. It's shocking. It really is shocking. We're up against the bottom of the hour break. When we come back, we're going to talk a little bit about what people can do and about the program. So stay tuned. News Talk 1270, KIML, Don Carpenter Show. We'll be right back.
Have an event you'd like to promote on the show? Email Don at doncarpenter@basonsradio.com. You're listening to Don Carpenter on News Talk 1270 KIML.
News Talk 12
right now, 682-1270.
I always forget that part. News Talk 1270 KIML, Don Carpenter Show. I want to thank you for joining us this morning. And if you're just tuning in, we're talking about the new suicide awareness and prevention campaign being kicked off. I guess today's the kickoff date. It's a pretty serious problem here in Wyoming and Campbell County in particular. We're talking with Peter Edis and Mike Purcell from Campbell County Memorial Hospital. And during the last break, we talked a little bit about some of the signs to look for. I guess the next step would be, once you see somebody that exhibits some of these signs, social withdrawal, maybe somebody that's at risk for an impulsive suicide attempt, lost job, nasty breakup, that kind of thing. Once you see somebody that has some of these signs, I mean, what can you do to help them out?
Well, it kind of depends on the nature of the psychopathology. For one thing that's kind of very interesting also to note, a sign is a recent visit to an emergency room for a behavioral issue. That also has a high correlation with making a suicide attempt in the near future. When we start getting into treatment, particularly for things like depression, we found that antidepressants are very helpful, along with cognitive behavior therapy. You don't want to do one without the other, particularly when suicide ideation or suicide attempt has been made. For some of the psychotic disorders like schizophrenia, it might take a different approach. Again, you would be using some psychotherapy, but clozapine has also been found to be very effective in the treatment of suicidal people that have the schizophrenic syndrome. Another high-risk group is that I found is basically the people that are diagnosed with borderline personality disorder. They have a notoriously high suicide attempt and unfortunately a fairly significant completion rate. A type of therapy that we just basically began at the hospital through the tutelage of Dr. Brooke England is a dialectical behavior therapy, which is proven to be very, very effective in treating borderline personality disorder.
I mean, I'm sorry to interrupt you. Actually, that's one of the things that when I was talking in the last break about people that self-harm, I mean, doing harm to yourself is a major sign of borderline personality disorder, isn't it?
That's common.
Cutting and
yes.
cutting especially. So, I mean, it's fairly easy for even maybe not even a suicide attempt, but it could turn into a suicide because they may, cut the wrong place, or they, I mean, it's a dangerous activity. And I mean, what is it about the borderline personality disorder that causes that kind of self-harming mentality?
What's kind of a very interesting point that you make, Don. There is that possibility that in cutting they could hit an artery. It usually the borderline are beginning to cut fairly young, pre-adolescent, and when I've interviewed borderline personality disorder folks, I find that they're not making a suicide attempt through the cutting. The vast majority are basically seeking some sort of psychological relief, which may seem very, very strange to people that are not familiar with this disorder. But through the cutting and the pain, they feel a release, and it kind of it's almost like taking something like a benzodiazepine or something to relax them.
But let me jump in here. Sure. We're talking about suicide versus a behavior that
Correct.
is associated with a psychological disorder. Right. Suicide and borderline personality disorders certainly go hand in hand, but we're talking about a social problem amongst the general population that's not limited to people that have a diagnosed mental disorder.
Oh, absolutely. I mean, it could happen to anyone, and it was a little bit of a sidetrack, but that's one of those situations where somebody might not be even intending, but again, the result ends up being a suicide, and that's what we're trying to avoid. If someone
has a diagnosis like that, we look for those behaviors.
Right.
Unfortunately, it can occur with anyone, and we need to be aware of those warning signs with the general population as well.
Sure. So I mean, if someone out there, and I know there's someone listening right now that has someone at home or a friend that is at risk, and I mean the statistics bear it out. I mean, somebody listening right now is going to have a friend or family member that commits or that at least attempts a suicide attempt within the next year. I mean, what was it? I think 120?
165 in the past year.
Yeah, I mean that's I mean, so the statistics would bear it out that someone out there knows someone that's going to at least attempt. So I mean, once you spot the signs, and we know to get the person professional help, either a combination of therapy and medication or one or the other. How do you talk someone that might not be willing to go get that help? I mean, how do you talk them into that? I mean, a lot of these people, I'd imagine, they think things are so hopeless that it's not even worth going to get help.
That's correct. They frequently, Don, will feel that things are so hopeless that there's no point, or they may have part of what I was going through is these highest risk categories, of which I find there's about 5. And as you noticed, as I was going through some of them, that the treatment approaches are going to be somewhat different for each. Certainly, you're not going to give somebody with depression clozapine, basically, or somebody that might be suicidal that has a substance abuse problem. They're going to need a very different approach. Maybe they need residential or an intensive outpatient type of therapy to address their addiction, which is correlating to their suicidal nature. One of the big keys that when somebody is expressing suicidal plan or intent, not to leave them alone. You don't want them to leave. This is not one of those retroactive that now that we've gone through it, we can correct our mistake. Once somebody's committed suicide, there's no going back and undoing it. So we can't have a retroactive plan. We got to be very proactive with that one. So you can't leave somebody that is telling you that they plan to harm themselves and let them be by themselves. They have to be brought to the emergency room. Whether the family member or best friend or employer brings them there, or the sheriff's department, somebody has to bring them in for evaluation. We got to get some treatment going.
So, I mean, this might be a situation where you might need to call the hospital or the sheriff's department to have them brought in if they're insistent that they don't want to come in.
That's correct. You have to.
But I mean, it's for the better. I mean, a lot of people might be kind of hesitant to do that, but I know
it's on that. People think, well, my friend will hate me forever. This is awful. The police coming to my house to take me in, but we have to do it. I mean, there's no undoing a suicide.
Right. And I mean, if the guy hates your guts for the rest of your life, at least he's still alive.
He's still alive.
And I mean, I'd imagine most of the time, once the underlying issues are addressed, that people kind of understand, hey, this was done, to help me out, and they'd appreciate it. I imagine most of the time.
Yeah, friends will do the most difficult things to help other friends.
Yeah, and I think that's the most important thing we're trying to get out there. I mean, we need to let everybody know to not be afraid to call. And I think a lot of people are also afraid to get the authorities involved because of the stigma involved. And I mean, it's not like something where you're going to have a criminal record or anything like that. I mean,
no.
And I think a lot of people are afraid of that as well. Looks like we might have a call. Let's go to the phones. News Talk 1270 KIML, Don Carpenter Show. You're on the air.
Yes, thank you. I've been listening, but I will say that the police in this town have something to do with the number of suicides. My son was in jail and tried to commit suicide. He managed to do it within a month later, and they did not tell anybody. So the law enforcement and the police in this town demean.
Yeah, I mean, I'm not sure. I mean, I'm not sure exactly where that was going, but we can talk about that another time. Let's try another call. News Talk 1270 KIML, Don Carpenter Show. You're on the air.
Hello?
Yes, you're on the air.
Hey, Don, how you doing, sir?
Good. How are you doing today?
Oh, pretty good. Thanks for taking my call. Listen, I just wanted to say that obviously when a person is thinking about or attempting to commit suicide, it's because they're believing that things are so bad that life is not worth living anymore. And while I applaud any efforts to prevent that from happening for any individual, the real answer is much deeper than medicine and psychoanalysis. It's a spiritual thing, and the answer is Jesus Christ. And when a child, especially in the youth, they believe that they have to do or be a certain way to be cool, or if somebody says a certain thing about them, it's automatically true, their self-worth plummets, and that's what creates these desires. Jesus Christ frees us all from all of that kind of stuff.
Oh, yeah, and thanks for the call. And I mean,
certainly a valid point.
Yeah,
and we do use the church. We refer people to their church, to their priests, their ministers,
With suicide,
as an ancillary adjunct to treatment.
And with suicide, we talk about risk factors and protective factors, and certainly a strong faith is a protective factor.
Yes.
Oh, and that's an excellent point. And we're actually going to take our last break, and we'll come back and we'll kind of wrap things up. News Talk 1270 KIML, Don Carpenter Show. We'll be right back.
Out of town and still want to listen? Stream the show at DonCarpenterRadio.com. Don Carpenter on News Talk 1270 KIML. Call Don now, 682-1270. News Talk 1270 KIML.
News Talk 1270 KIML, Don Carpenter Show. Thanks for joining us this morning. And we only have a few minutes left with Peter Edis and Mike Purcell from Campbell County Memorial Hospital. We're kicking off the big suicide awareness and prevention campaign. And I guess the bottom line is, if you see somebody that has some of these signs that we've talked about, you need to talk to them. You need to get something done. And like you were saying, don't leave them alone.
Absolutely, Don. You don't want to leave them alone. Get them to an emergency room. Let an emergency room doctor at least get the first part of the evaluation going.
And the hospital is fully equipped to take care of pretty much any kind of problem that they might have.
Absolutely.
Absolutely. People can also call 1-800-273-TALK or 1-800-273-8255, which is the National Suicide Prevention Hotline. They have trained professionals available to talk with either the person that's contemplating suicide or friends and family or concerned ones. Again, it's 1-800-273-TALK, 1-800-273-8255. The hospital also has resources on their website. It's www.ccmh.net/prevent-suicide, www.ccmh.net/prevent-suicide.
And we also, on all the Basin radio stations, will be playing commercials throughout the year with various local officials and everybody coming in to share the number and the website as well, so we can make sure we get the. Somebody might not be listening today. I mean, I'll even have it up on my website as well. So
you can also call behavioral health at 307-688-5000 and ask for Mike Purcell.
Okay,
there's another resource.
307-688-5000.
And also, Don, there's lots of information out there on the internet. The National Institute of Mental Health has loads of information for people that they can learn more about suicide and what they can do to help prevent it. SAMHSA, the Substance Abuse and Mental Health Services Administration, has a lot of literature as well. There are resources, and there are some people that in our community that really care and know what to do to diagnose and treat people that have this disorder. A last note I would have to say is, if you suspect that somebody is suicidal, remember that you got to take it seriously. There's no going back from a suicide. From a successful suicide, you can't redo it and roll the tape back and get it right the second time around. You have to get them in for evaluation. Also, if somebody is really depressed, expressing that life is maybe not worth living anymore, you have to secure medications. You also have to secure weapons. It's just common sense.
Right, and the bottom line is, don't be afraid. That's the important thing. Don't be afraid
to reach out.
Yeah. Don't be afraid to get some help, and there's plenty of people here that are willing and able to help out. So we want to make sure that everybody knows that, and that's the bottom line. So I want to thank Mike and Peter for coming in from Campbell County Memorial Hospital. Thanks for helping us out with this and getting the word out. That's why we're here.
Thank
you. We
Thanks
appreciate the opportunity to be here.
And with that, we're at the end of the show. Thanks a lot for joining us. We'll see you tomorrow morning at 6 o'clock. Stay tuned for Rush. News Talk 1270, KIML, Don Carpenter Show. I'll see you tomorrow.
If it's happening in Wyoming, He's talking about it. Don Carpenter on News Talk 1270 KIML.